My name is Dr. Elizabeth Sternberg, and I am a pediatrician at Gilbert Clinic, and I specialize in autism evaluations and diagnosis. So what is autism? That is a big question that I get asked a lot. And essentially, it's a neurodevelopmental disorder, and it's characterized by certain core features. So those core features include deficits in social communication, so not having good eye contact and not using gestures when you're talking. Also deficits in social interaction, so not being able to relate to other peers, not wanting to even interact with peers. So it could be anywhere from, I want to interact with other kids, but I don't know how, to I don't want to interact with anyone and I want to be by myself. The other core features are repetitive behaviors and restricted interests. And the spectrum can be anywhere from very, very mild symptoms to very, very severe symptoms. So there's a really big range of kids that fit underneath this diagnosis category. Currently in the United States, the statistics are that 1 in every 68 children has an autism spectrum disorder. So that's a lot. You know, April is Autism Awareness Month, and the most common questions that I get from individuals even before they come see me is, what are the signs of autism spectrum disorder? What's the common signs? And so I like to give out a lot of early warning signs, because as we'll talk a little bit later, early intervention is really key for these kids. So some of the most common early warning signs for families are a child that may not smile, show happiness, interact with you by 6 months of age. They don't babble, they don't make consonant sounds, mama, dada, anything close to that by 12 months of age. They don't use gestures, so commonly you'll see young kids pointing to things, or they learn how to clap or wave bye-bye by a year of age. If they're not doing any of those things, that's very concerning. They haven't developed a single word by 16 months of age. If they're not able to put 2 words together by 2 years of age, so, you know, common little phrases that 2-year-olds can say is like, mama up, daddy go. But if they're not really putting those 2 words together by 2 years of age, there's definitely delays in speech. And at any point in time in their early development, if they've learned words, they've learned how to speak, and they've lost those words, that's very concerning. You know, research has shown us so far that early intervention for kids on the autism spectrum makes a tremendous amount of improvement in their development and their prognosis in the long term. The first thing I recommend is have your child screened for an autism spectrum disorder. That's first and foremost. In recent years in Kentucky, the role of who can diagnose autism spectrum disorders has really expanded a bit, so that families can access that service. Some examples of other providers that can do this type of evaluation are psychologists, psychiatrists, and then, you know, I'm kind of the out-of-the-box kind of individual. There are very few pediatricians that have gone through training to do this type of evaluation, but if they do, that's another resource. There's usually not a long waiting list. I'm able to get kids in and out, and so I feel like we're making progress, getting them plugged into the therapies that they need right away. So the ADOS test, the Autism Diagnostic Observation Schedule, or the STAT test, the screening tool for autism in toddlers and young children, will do one of those hands-on play-based tests, me and the child together, so I can look for some of the symptoms and identify whether there are significant concerns. So people wonder with autism, is it only something you can diagnose when a child is young? And the big answer to that is absolutely not. This is something that is commonly diagnosed in older children who may not have been picked up when they were young. You may not be able to notice abnormalities when they're very young, but as they get older, if you're noticing that they're struggling with social skills, if you're noticing that they're having trouble tolerating light, sound, taste, touch, it is imperative that you get those children screened and assessed, because no matter at what stage in life they are, there's always interventions that can help. For Autism Awareness Month, the biggest thing I would tell families is, if you are concerned about something with your child, talk about it, get it evaluated, get a screener done, do something. Don't just think, oh, it'll get better with time. Bring it up, because it may not be something, but it may be something. You don't want to just push it under the rug. It's important that families understand that autism spectrum disorders, they're not taboo, I guess is the best word. It's not a bad thing. People give it a lot of negative connotations out there. They're like, oh, my child can't have this. We don't realize how many famous people in history were on the autism spectrum and how much they have done. It wasn't identified back then. So the important thing is we want to give these individuals the tools to make their lives a little bit easier so that they're not struggling constantly day after day, not understanding why they see the world a little bit differently than we do. And that would be the main core reason to have your child evaluated, is that you can make their lives better.